Hi everyone, this is Tracy Wareing, CEO at the American Public Human Services Association, and on behalf of the board and the APHSA team, this brief presentation is set to provide you with a 2021 business update and a look ahead to 2022. I want to start by thanking each of you for your leadership. Our board and staff appreciate the incredible agility you've demonstrated over the past couple of years as we've navigated an uncertain and changing landscape. We remain committed to people in public service, building common ground, and partnering across sectors. I think at a time when there's still a great deal of uncertainty and certainly polarization across the country, these collective principles really help us to come together as a membership body, and we remain committed to them. We operate, as a reminder, under a common strategic framework developed with and through you as our members, referred to as the Strategic Playbook, and an annually updated action plan that helps focus our energies and make the most of the collective ingenuity of our members and partners. Our current action plan focuses on these three areas: moving health and human services upstream, advancing social and economic mobility, and building field capacity. They are our big picture goals that we are advancing through a race equity lens and working to understand what's right for action through enabling factors and key drivers. Coming into 2021, our new Cornerstone framework helped us prepare for a change in the federal administration. We were able to advance immediate recommendations related to the ongoing pandemic and establish an operating framework for longer range policy and practice changes. Subsequent Cornerstone policy papers focus on priority areas, including guiding principles for TANF modernization and modernizing technology and data infrastructure. Families First implementation is forthcoming shortly, as well as the role of equity and evidence-informed practices. The APHSA Governing Board has focused its strategic efforts on these three objectives: embedding EDI. So coming into this year, the board adopted a resolution on equity, diversity, and inclusion that advances the association's 2019 call to action to advance race equity by further embedding an equity, diversity, and inclusion lens in all we do as an association across all of our on-ramps. That includes the core work of many of you in our councils and affinity groups, and we'll share some ways that work is advancing and how we can provide support for each of you momentarily. We're evolving our business model with the sponsorship of the board. We continue to think about how to support delivery on our value proposition, including through the lens of what has changed since the pandemic and what that tells us about how best to meet member needs and opportunities. We are in a growth mode that requires intentionality to assure strategic alignment and support development of meaningful deliverables across the APHSA enterprise. It's exciting. And we are working to optimize our strategic impact. And at a time with so many challenges and opportunities in the field of health and human services, including the once-in-a-generation investments through the American Rescue Plan, we are working to optimize our strategic impact and make sure that that remains a priority. And so it requires us to think about strategies that are agile while also providing clear guardrails for action within our mission and scope. We've made some adjustments to our 5-year strategic planning process to ensure we can continue to meet the needs of the moment and plan for the future. And I'll talk about this slide shows in a little bit more detail how we've advanced race equity and worked to embed EDI in our collective work, from advancing policy and practice by embedding a race equity lens in the cornerstone framework and our policy papers, to the work of our organizational effectiveness team, and the tools that they provide to the field as we work to support building field capacity, directly linking practitioners to federal partners and other researchers who are developing specific learning agendas around advancing race equity, and then capturing real-time lessons from the COVID-19 pandemic and doing that through a race equity lens, as well as providing additional information to federal agencies as they work to do the same in their own organization and departments. We've modeled and connected by providing peer communities specific to equity, diversity, and inclusion, more intentionally lifting up and including youth and parent leader voice in our events, showcasing through both virtual and hybrid conferences and events, a number of sessions where we've brought leaders from many different places to showcase how they are advancing race equity and embedding EDI in their work, and including plenary sessions with speakers who are really helping us understand how to get at root causes and how to embed the work more directly in the human services sphere. All of this, of course, is part of also exercising and building our own muscle, and our team has been through a number of intentional efforts this year, including with some outside input into advancing our ability to build our own muscle. So people, partners, and technology are really at the heart of what we need to deliver on our value proposition. They're the core infrastructure that APHSA is built on in order to deliver on our mission. This year, we've been hyper-focused on making strategic investments in our team capacity and the tools we need to carry out the work, as well as building partnerships for impact and extend our capacity to make progress on those key focus areas of moving upstream, advancing economic mobility, and building field capacity. I won't belabor the other points here except to share that we are excited to debut next year a learning management system which will allow for more on-demand and asynchronous learning opportunities, and you'll hear more about that in the coming year. Early next year, we will release our annual report, but we wanted to give a few highlights from the progress made in 2021 from our leadership and local council, as well as each of the affinity groups. So I'm just going to go super quickly through these to give you a sense of some of the progress made toward our 2021 action plan. Certainly, the Leadership Council was at the center of our policy work, working both with Congress and the administration. We were able to broker a number of direct discussions with state and local executives. We also informed a number of real-time communications with our federal partners. We additionally launched a new series through the local council focused on practice-level challenges that dealt with the COVID-19 response, building integrated delivery service models, and in meeting the unique needs of rural communities. We also had great contributions from each of our affinity groups, from the affinity groups in support of the mission enterprise as a whole, including legal, IT, and staff and development and training. Each one of these affinity groups held a conference this fall. The attorneys and staff development affinities met virtually for the second year in a row, and the IT Solutions Management for Human Services group was able to hold its first hybrid conference and expo, as well as launch a new series of peer exchange calls for state and regional representatives, and continuing to expand the popular Emerging Leaders program. Our Staff Development and Training Association hosted a virtual showcase series with some very innovative efforts in staff training and development and advanced race equity throughout their convenings. There was a great deal of activity across the SNAP directors, TANF administrators, and program improvement and performance management affinity group, including a joint conference that all three of them held around the theme of economic mobility that was co-hosted with the National Association of Welfare Research and Statistics. The SNAP directors spent a great deal of time lifting up and sharing best practices in response to the significant policy and benefits delivery challenges they were facing as a result of the pandemic, particularly around the pandemic EBT. And we partnered with members from other national research and advocacy organizations to develop cutting-edge research on the role of SNAP during the pandemic. The program integrity folks also came together with SNAP to think through both SNAP quality control and policy as we think about the future of what quality control will look like. And the TANF administrators made significant progress in establishing core principles for TANF modernization and a legislative framework to advance them, as well as partnering with the National Association of State Workforce Agencies to develop cross-sectional workforce development learning opportunities. Our child and family focused affinity groups, the National Child Welfare Administrators and the National Child Care Administrators, also had a very busy year. They spent a great deal of time ensuring families were well served during the ongoing pandemic and lifting up and working with both Congress and the administration to resolve barriers as they arose. Specific to the child welfare administrators, there's the ongoing focus on implementing the Family First Prevention Services Act and resolving and trying to work through, both with Congress and the administration, barriers to that effective implementation. The child care administrators provided additional, especially recently, have provided additional support as Congress considers expansion of child care in terms of understanding the administrative burden on states and the kind of things that will have to be done in order for that to be an effective expansion if it goes through. And our NEAS, which is our National Electronic Exchange System, is now in 43 states under the Association of Administrators for the Interstate Compact on the Placement of Children. We have released a redesigned NEAS 2.0, which won a National Best of NEAM award, which is the National Information Exchange Model Data Standards, which was exciting. Given the current landscape, we believe it makes sense to extend our current strategic playbook through 2023. What this really means is a year extension of the 5-year plan we've been operating under. Our current playbook is clear. It's been highly suited to delivering on our mission at this time. We think given the challenging operating circumstances for the field, with so many pressing issues, including a continued public health emergency, as well as many breakthrough opportunities with once-in-a-generation investments in the care infrastructure and different aspects of human services, it makes sense to focus our efforts on executing on the strategy and defer some of our planning time until next year, which we will begin at the end of 2022. In the meantime, we'll refine our annual action plan in light of the current landscape and build on opportunities for impact in 2020. Over the summer, the Leadership Council updated guiding principles for our collective policy work, which really takes into account the current landscape and how it's evolved and changed over the last couple of years. These guiding principles serve as a foundation as we look ahead to 2022, and the Council itself is in the process of recommending 1 to 3 areas for an association-wide proactive federal influence strategy, and we'll use these as big plays that will support system-level change, and you'll hear more about that soon. So looking ahead to 2022, we recognize that one of the things that remains constant is uncertainty, especially in light of the ongoing national public health emergency, the ongoing high tensions across the nation, and the political divisions. We are focused on how we can be strategic together, the ways in which we can optimize investments that are happening in health and human services, looking for cross-system opportunities, and thinking about the design of our events to be meaningful and impactful for folks, particularly as we look to come together in person in 2022. We do want you to save the date for the Joint Leadership Strategic Planning Session at APHSA's offices in Arlington, Virginia, which we hope to hold on April 29th. Much more details will come. We also welcome additional conversations with you and encourage you to provide direct input on our 2022 priorities through your affinity group staff liaison, both specific to the work that you're doing as a council or an affinity group, but also in the ways that we can think about association-wide impact. So thank you all for listening, and let us know if you have any questions.